Hello, fellow type 1s out there. Today, I'm going to talk about when and if your insulin goes bad. How do you know? My name is Dr. Jody Stanislaw. If you are just finding me today, I've been going live almost every day, Monday through Friday, since end of March, since we're all stuck at home, and just wanted to give inspiration and motivation and tips to all of you with type 1 for how we can get excellent blood sugar care. Because if you're not getting excellent blood sugar care right now, you're putting yourself at risk, right? It's weakening the immune system, not to mention the damage that it does to our bodies. I've had type 1 for 40 years, and I've dedicated my career to helping type 1s all around the world through my virtual practice, through my online courses. And I'm just decided to come on Facebook Live every day around this time, 3 o'clock Pacific, 6 Eastern, to just give you some tips. So today's tip is, it's starting to get hot. Well, hopefully, right? It's summer, spring is coming, or summer's coming. And insulin getting too hot is going to make it not work. Now, if people always ask me, well, how hot and how much is it not going to work, right? Well, it's not on or off. It's not a switch that goes on or off. It's not like, oh, my insulin, works fine today and now it doesn't. Well, actually, no. Let me take that back. If you keep your insulin, like say in a hot car, and it gets up to 90, 100 degrees in there, yes, it will be gone. It's a protein, it denatures. You're basically cooking the protein, and it won't work if it gets too hot. So yes, we do have to make strides to keep it out of extreme heat. Now, having said that, I've traveled all around the world, for those of you that have been following my travels on YouTube, and as long as it wasn't in direct sunlight, I'd keep it in a bag, I'd keep it in the shade. I actually never had it on ice, or I never had it in a cold pack, and it was fine. Now, there's a couple things that make insulin's potency weaken. So it still works, but maybe the potency is not as strong, right? So they say insulin goes bad after 28 days. And I'm here to say, well, it's not like it's 100% potency on day 27 and 0 on 28, right? I've noticed that if I have insulin open for longer than 28 days, it just kind of weakens its potency over time. So for those of you that don't have good coverage for your insulin, I don't always see it go to 0, on day 29. But just you have to become aware of if, your highs aren't coming down, or your long-acting insulin maybe got too hot and now you feel like you're just running high 24 hours a day, stuff like that. If you're starting to see trends that aren't normal, then yes, definitely think about, is my insulin been open too long? Or of course, did my insulin get too hot? So there's no fine line, just like I say for all my patients with diabetes. We're not easily managed with strict rules. I have a whole course about why I think carb counting alone doesn't really work. And even setting your basal rate, you really should know how to do that, because that can change a lot. There's needs for temporary basal rates. Like, diabetes isn't a flat line. Diabetes isn't about certain ratios and rules that fit perfectly, right? We have to be flexible when it comes to diabetes. So that's what I'm talking about today in terms of, when does your insulin go bad, right? Well, it goes bad if your highs just aren't coming down time after time after time. That's a pretty good sign. But then again, there's lots of other things that can cause extended highs, right? Hormones, getting sick, being extra sedentary, eating high-fat meals. So I guess my conclusion is, I can't really tell you exactly when your insulin is bad, but just be smart, right? Keep it out of the heat. Be aware how long the bottle's been open. If it's been open longer than 28 days, kind of heighten your thinking about, could this high be due to old insulin? And don't freak out if you don't have an ice pack on it at all times, but definitely freak out if you left it in the car and then it got 100 degrees for hours. We got to just be smart. We got to be real smart when it comes to diabetes. So I have lots of courses that can help you get an A1C below 7%. That's what I'm also very passionate about. And frankly, even below 6.5, right? ADA says below 7%. American Association of Clinical Endocrinologists suggests below 6.5. Now, of course, like with diabetes, there's no one rule for everybody, but I'm passionate about helping you get better blood sugar levels. And that's why I've made courses, how to get off the blood sugar roller coaster, mastering your blood sugar with exercise, and nutrition and how to dose. So I encourage you to check those out if your A1C is not even close to a 6. And they're at drjodyn.com. and you click on T1D classes and you'll see all my courses there. So I'm here to inspire you with type 1s to have a happy and healthy life. I hope you've enjoyed today's video. You guys have a great weekend, and I'll be back on Monday. Bye for now.